We already have a long list of questions that we want to get to immediately. Dr. DeGutis, I think you're best prepared to answer this first question. Dr. Sondek's slide showed that falls have drastically impacted the senior citizens. What is being done to address this population?
Thank you. Yes, I think this is a really important issue and important area to focus on. We've been working with some of our state health department partners in New York, Colorado, and Oregon to address falls and preventing them using a comprehensive approach. Each of the states is implementing 3 evidence-based community fall prevention programs that are targeted towards adults who are at different levels with respect to their ability to exercise and to move. These are called Stepping On, which is a program that has been designed specifically for all the adults. And then there's Tai Chi, Moving for Better Balance, and then an Otago exercise program, which was developed and studied in New Zealand. Each of the states is also disseminating STEADY, which is a toolkit that we designed for healthcare providers. And the goals of this toolkit are to increase fall prevention in clinical practice settings and link clinical referrals to the community programs. This is in its 2nd year, and it's a comprehensive approach that is expected to demonstrate measurable decreases in fall injuries within the places that have implemented it by the end of this 5-year funding period. This STEADY toolkit actually allows practitioners to assess the risk of falls in their patients, and it's based on a simple algorithm that was adapted from the American and British Geriatric Society's clinical practice guideline. There are basic information about falls, case studies, conversation starters, and standardized gait and balance assessment tests with instructional videos. There are also educational handouts about fall prevention that are specifically designed for patients and their friends and families. Thank
you, Dr. DeGutis. I'm going to have to reach out to our representative from the Bureau of Labor Statistics for our next question, Bill Witrowski. The question that was submitted is, most of the data for Healthy People 2020 occupational safety and health objectives are from the Bureau of Labor Statistics. Are there any specific data for health disparities in this area?
Thank you very much for the question. The Bureau of Labor Statistics provides some of the data used in the Healthy People 2020 related to work-related fatal work injuries as well as non-fatal injuries and illnesses. And in the area of fatal work injuries, we get a comprehensive census of every fatal work injury that occurs in the country over the year, roughly between 4,500 and 5,000 each year. For the non-fatal data, we do a survey of employers to gather information about non-fatal injuries and illnesses that have occurred during the year. We count somewhere between 3.5 and 4 million non-fatal work injuries each year, and we're only able to get comprehensive details about the worker and about the circumstances surrounding the particular injury for a subset of those cases. And in many cases, we have difficulty getting some of the information, specifically things like race and ethnicity. And so we do have a concern that we're not sometimes able to provide the most comprehensive data about some subsets of populations, for example, Hispanics or other or immigrant populations, and that we may not be able to get as comprehensive data as we'd like. So there is the potential that we are not that there are some disparities between groups of workers that we're not able to provide comprehensive data.
Thank you, Bill. The next question I will send to Dr. Sondek. One of our participants is saying that they're curious to know how work-related is defined. Does it include domestic violence or homicides that happen in the workplace?
Yeah, thanks for the question. Actually, Dawn touched on this. It does include that. And it's interesting. She emphasized the disparity here, where if there was one slide that was called the percent distribution of work-related homicides by perpetrator type. And if you look at females, 25% of those homicides are committed by relatives, compared with 3% for males. So there's quite a disparity, and Dawn may want to say something about that. And there's, but the data is collected.
Yeah, so the work-related incidents are generally defined that an injury occurs when someone is at work or in the course of doing work. And so when intimate partner violence encroaches into the workplace, we do capture that.
Thank you, Don. Dr. Sondic. Dr. DeGutis, the next question is for you. How is the Injury Center responding to President Obama's plan to protect our children from gun violence?
Thank you. We are responding to it by following the directive that he has issued. One of the requests in his directive was that we develop a research agenda for gun violence prevention. And, we are now working with we have a contract with the Institute of Medicine in collaboration with the National Research Council to appoint an ad hoc committee of external experts to develop a proposed public health research agenda on the causes and prevention of gun violence. And the goal of the committee is to identify gaps in knowledge to better understand the causes of gun violence and prevention strategies to reduce the public health burden of gun violence. And the questions that are generated will be in alignment with the President's directive. There is a public meeting taking place at the IOM and NRC next week, April 23rd.